Hi, I'm Hannah Dean and I'm the Programmes Manager at International Health Partners. International Health Partners coordinate medical donations to vulnerable countries all over the world, including the Middle East. I want to appeal to you today about the situation in Lebanon, where many Lebanese describe the situation as the worst they've ever experienced. Lebanon is currently facing a severe economic crisis, with the Lebanese lira depreciating daily, causing increases to unemployment and poverty. According to the Office for the Coordination of Humanitarian Affairs, there's an estimated 3.2 million people in need, over half of the total population in Lebanon. The situation is described by many as one of the worst humanitarian crises of our time. Lebanon continues to host the highest number of displaced people per capita, including 1.5 million displaced Syrians and nearly 210,000 Palestinian refugees. Furthermore, there is now a reported famine across the country, creating food insecurity for many. We've heard stories that some people have been unable to afford food during Ramadan and Eid celebrations. COVID-19 has further exacerbated the situation in Lebanon, with 4,300 cases of COVID-19 currently reported. The virus has spread to at least 2 refugee camps, which poses increased risk to co-infection due to overcrowding and poor living conditions. Lebanon sees increased cases of non-communicable and chronic diseases such as hypertension and diabetes. These conditions require a constant supply of medicines for patients who typically take them for life. The health system in Lebanon is extremely stretched, with chronic shortages to medicines and medical supplies. Due to the economic crisis, the need for gift-in-kind donations of medicines is now more important than ever to ensure a constant supply of medicines to the patients who need it. As you have seen from the horrific images and footage, on the 4th of August, there was a massive explosion at the port of Beirut, Lebanon's capital, and the resulting shockwave rippled through the city, killing over 200 people, injuring more than 6,000, and leaving 300,000 people homeless. At least 15 medical facilities, including 3 major hospitals, were damaged in the blast. Much of the national warehousing was in the area surrounding the port and was totally destroyed. As a result, there's been an enormous loss of stock of medicines and medical supplies. At the time of the explosion, one of our in-country partners had 7 containers of medical product awaiting clearance at the port. These were due to be used at health facilities across the country, particularly focusing on those serving refugee populations. All 7 containers were destroyed in the blast. This latest disaster has made the situation in Lebanon even more precarious. International Health Partners is responding to this disaster by air freighting urgent shipments of the most critically needed medicines and supplies, including antibiotics, wound dressings, and chronic medicines. 2 shipments are nearly ready to go, and we're hoping to send at least 4 more to support the response efforts. So far this year, International Health Partners has shipped over 26,000 treatments to Lebanon, including medicines for conditions such as diabetes and hypertension. We're currently building a further shipment of over 36,000 treatments to further support refugees and other vulnerable people during this crisis. It's important to know, however, that we have now been able to do this and make this happen with the support of our wider community. We cannot do this alone. With your support, we will be able to ship more medicines to vulnerable people in Lebanon in response to this double crisis that many are experiencing right now. On behalf of International Health Partners and our recipient partner, I want to thank you for standing with us to help support the people in Lebanon. Thank you.